A groundbreaking development in HIV prevention has emerged, but it comes with a catch. South Africa's health minister, Aaron Motsoaledi, has praised the world's first twice-yearly HIV prevention jab, Lenacapavir, as a powerful tool to combat the disease. However, he warns that the initial supply donated to South Africa will only reach nearly 500,000 people, a fraction of those in need, in the country with the highest HIV prevalence rate globally. This news follows the U.S.'s recent announcement to purchase 2 million doses of the HIV prevention drug for low-income countries. The initial supply in South Africa is scheduled for April 2026, funded by a significant Global Fund grant and additional support from the networking HIV and AIDS community of Southern Africa, NACOSA. Speaking at a national healthcare roundtable in Johannesburg, Minister Motsoaledi emphasized the impact of the Global Fund's commitment, which will provide Lenacapavir to approximately 456,000 individuals over 2 years, equating to 912,000 doses. He outlined the plan to initially roll out Lenacapavir in 23 high-incident districts across 6 provinces, targeting around 360 high-performing public clinics. About 500,000 people will gain access to Lenacapavir, but demand is expected to exceed supply initially, Motsoaledi stated, adding that research suggests prioritizing vulnerable populations in high-burden districts would have the greatest impact in preventing new infections. The minister also cautioned against complacency, highlighting the severe impact of abrupt funding cuts from USAID and other U.S. government sources in early 2025, which significantly affected HIV, AIDS, and tuberculosis treatment, prevention, and research programs across South Africa. While expressing gratitude for Gilead's price reduction from $28,000 to $40 per person annually, Motsoaledi emphasized South Africa's aim to fund its program independently, with long-term funding dependent on Lenacapavir's integration into local systems, such as the Essential Medicines List. The World Health Organization, WHO, recommended the 6-month HIV prevention jab in July, already approved in the US and Europe as an additional prevention choice within combination approaches. Gilead is expediting registration in 18 high-incidence countries, including South Africa, to deliver Lenacapavir until generic versions become available in 2027. However, controversy surrounds Gilead's voluntary licensing agreements. Early in October, Gilead Sciences announced voluntary, non-exclusive, royalty-free license contracts with pharmaceutical companies in Egypt, Pakistan, and India to produce and market generic Lenacapavir. South African companies, despite participating in the drug's clinical trials, were excluded from these licenses. And Mbilikama, speaking on behalf of the South African National AIDS Council, SANAC, claimed that 1 in 4 new HIV infections occurred in the 26 nations Gilead didn't grant licenses to. You can't come into our house, ask to learn, and then exclude us. Wendy Cupido, Gilead's country manager, explained that South African manufacturers evaluated in 2024 didn't meet the technical specifications for sterile injectable production at that time. However, she stated that Gilead remains open to further voluntary licensing if a South African manufacturer can develop the required capabilities and meet quality standards. Welcoming the over $34 million investment in the rollout, Eva Kiwango, UNAID South Africa country director, emphasized the importance of long-acting injectable medicines as a fresh option for all at risk, especially in a climate where foreign assistance funding cuts could lead to an additional 6 million HIV infections globally by 2029. Lenacapavir is not a cure or a vaccine, but it could be a game-changer if accessible to all who could benefit, said Kiwango. For many, Lenacapavir expands choice, strengthens agency, and reduces barriers linked to stigma, disclosure, or daily adherence. The National Healthcare Roundtable, a 2-day event, will conclude on Wednesday, providing further insights into this groundbreaking development and its potential impact on HIV prevention efforts in South Africa and beyond.